Now to the latest on the pandemic and the surge in Omicron cases. While hospitalizations are still up across the country, some states are seeing a decline. One state that's past that peak is Rhode Island. Right now, 460 people are in the hospital with COVID in the state. And while that number is still high, it's definitely better than the 592 hospitalizations the state saw less than 10 days ago. NBC anchor Yasmin Vossoughian joins us now from outside Rhode Island Hospital in Providence, which was pushed to that breaking point just earlier this month. Hi, Yasmin. Good morning.
Good morning, Savannah. It was pushed to the breaking point. It seems as if this hospital in Rhode Island, which I've been reporting from for the last couple of years throughout this pandemic, was really hitting its peak about 10 days or so ago. They were pushed to the brink, as you mentioned, totaling cases over 500, now below that 500 number, but still this hospital very much pushed to the brink, the ICU, the emergency department as well. But we remember from the president's announcement just about 2 weeks or so ago that they were going to send military personnel to various hospitals throughout the country. This is one of the hospitals in which those military personnel have now showed up just a few days ago. 20 doctors and nurses here helping out with the effort to fight the Omicron variant and the COVID surge here in Rhode Island. Want to bring in the president of the hospital, Dr. Weingart, who has been experiencing kind of the surge throughout the last year in which you've been on the job now. And of course, now with the military personnel in place to help with the hospital surge. Talk to me about how that's been for you.
It's been incredibly helpful for us. Emotionally, morally, it's been a real lift to have additional skilled staff with us. What we've been able to do practically is assign the staff from the military to a variety of different units, largely to our COVID intensive care units, but we've been able to assign staff to the emergency department and also to our med surgical area. It's been very, very helpful.
Do you feel like you're past your surge now of this Omicron variant?
So we were at a peak census of COVID patients of about 170 patients in our hospital, which was about 1 in 5 patients on the adult side.
Wow.
We were there for about a week. Over the last 4 or 5 days, we've begun to see the numbers come down. So we're certainly on the downtrend, but we still have a full hospital with lots of COVID patients and pushed to capacity.
How long are you expecting the military personnel to stay in place?
All right, so they began last Saturday, and they have a 30-day assignment with the possibility of renewal. So we'll see how that goes depending on our volume.
And what do you expect? Expect with them to stay?
We expect they'll stay 30 days, and we're hopeful that they may be able to stay longer, and that period will be incredibly helpful. It took about 6 weeks to get into trouble, and it'll take probably a similar amount to come down. So the fact that they're here at the time when we're just cresting has been perfect.
How worried are you about the next variant, the next surge?
You know, we're always worried the fact that we've had so many variants. We're expecting there'll be another at some point. We hope it won't be as catastrophic as Omicron. But at this point, we don't see any signals around the globe that there's something that's brewing that's going to be as problematic.
Last question to you. A number that I found interesting was that folks that were coming to the emergency department here and not being seen during the surge, right? And now that number being reduced with the military personnel because of the fact that you have more hands, more people. And you talk also about the psychological implications of having these folks here. Can you expand a little bit on that?
So there was a period about 2 weeks ago where we had very high numbers of patients leaving the emergency room without being seen. I think that's what you're referring to. Yeah, so those numbers have come down, and it varies day to day and hour to hour. But we've seen those numbers come down from the double digits to the single digits. I think it's partly because people are now perhaps avoiding emergency rooms because they know about the wait, but also because our throughput has improved and our capacity has grown.
Got it. And then, of course, the psychological implications just for your staff, for the doctors and nurses that have been overrun for the last couple of years of this variant and COVID in general. Dr. Weingart, thank you so much. I appreciate your time.
Thank you.
The one doctor I haven't met at this hospital as I've been covering this pandemic here. Thank you so much. Appreciate it. So, Savannah, as I mentioned, right, they hit their peak here, and obviously Dr. Weingart hoping that the peak is now past and they're on the downturn of this Omicron variant. But nonetheless, the surge of this military personnel, the 20 or so doctors and nurses here, very much helping out with the efforts to fight COVID here at Rhode Island Hospital.
Yeah, and the doctor with a little bit of hope there that we're not seeing any sort of signs of trouble brewing somewhere across the globe. That's great to hear.
Fingers crossed.
Yeah, exactly. Thank you, Yasmin, and please thank the doctor for his time on our behalf as well.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.